everyone, this is Erika Bennett with South Georgia Medical Center, and this is part 2 of a video communication series to help update the public on everything going on at SGMC and our facilities. Today I'm here with President and Chief Executive Officer, Mr. Ronald Dean. Mr. Dean, how are you doing today?
Good morning. I'm good, Erika. Thank you.
All right. There's been a lot of talk about capacity in healthcare systems and hospitals around, so can you give us a little update on where we stand?
Indeed. First of all, let me talk about our employees here. I just want to tell everybody, the viewing audience, how proud I am of everyone. I'm really amazed at our employees, our physicians, and everyone who is coming together to help us prepare, to plan, and to provide the care that's required under these circumstances. It's very challenging for the community, for the state, for the nation, and our hearts go out to them, but our mind is on our workforce. And Erika, you know this, you've been a part of this place for a long time, and it's a very unique place. It's a special place. We have 3,000 individuals that come here. They come from their home. They come from a variety of backgrounds. They live in a variety of communities, and they're trained in a variety of ways, and they come here. And they're here for this purpose that we're serving as we go through this crisis. And I'm very proud of them for stepping up, being prepared, committed, and doing what's required. And the community has shown so much support and love, and I just say again to the viewing audience, on behalf of all that are here and a part of SGMC, we couldn't be more thankful for what you've done. The food you provide, the prayers you provide, the parking lot prayers, the 30 days of prayer over our 3,000 that started just this week, it's just wonderful, and we thank you for that. So, well, let's talk about the current situation. And COVID-19 is still on our mind, and it will be for a long time. And I wish I could tell you something about it that you don't already know, but I think you know about as much as I do, and a lot of that is we're still trying to figure things out. The scientists are working hard to understand what's going on, and the hospitals and health delivery systems across the nation are doing what we believe is required to protect our workforce and to take care of those patients that are identified that's either suspected of having and or has been diagnosed as a positive. So to give you some capacity perspective, our hospital, on a routine, normal operating day, we can handle somewhere in the neighborhood of about 300 patients in a bed, and that's a variety of patients. That's every type of patient, from neonatal patients, the little bitty babies, all the way to the pediatrics, all the way to our rehab patients and the variety of patients that come in, surgical patients. And so today, for example, our census is close to 200 patients. Within that 200, there are about 35 patients that are either under investigation for COVID-19 or have been diagnosed positive. So that gives you an idea of the percent of the patients that are here as inpatients that are being either evaluated or have been diagnosed and are being treated. Now, how much more can we take? Well, that question is being asked every day, and what we've done thus far is we've set aside specialty care units where we can concentrate these patients and our nursing and care teams with these patients, so we don't have them spread out all over the organization, and that's been very helpful. How many more can we take? We have contingency plans that allows us to grow from 2 primary units, which are sitting at 48 beds, to up to 72 beds. And those plans are being evaluated every day by our clinically led response team. And so we'll have another discussion today about where we are compared to where we were yesterday, and then we'll decide what we need to plan for tomorrow. Here's the problem. We have no idea what's coming tomorrow. So we have to plan for worst case scenario. So I would say we're okay. We have beds. We have not accepted an abundance of transfers from others. Everyone knows we have accepted some transfers from Doherty. But we accept transfers and have accepted transfers from other counties because we are a regional medical center, and where would they go? Some of the other counties would not have anywhere to go. Doherty, of course, is coming because they are overwhelmed. So those are the things that we're thinking about from a capacity management standpoint.
Mr. Dean, a topic that's high on everybody's radar is supplies, especially in the healthcare field as it relates to staff being able to care for these patients that are coming in. How is SGMC managing that, and how are we adequately supplied?
Yes, great question, Erika. The supply chain throughout the nation is stressed. The federal government, the state of Georgia, our governor, and the local regions that help in emergency situations, are working really hard to make sure we're well supplied. And we've heard the stories from lots of other hospitals that are well publicized. They've run out of supplies at times. Our goal is to not run out of supplies. So contingency planning is about physical capacity, human workforce capacity, and supply management and supply capacity. So when we think about the fundamental supplies that one needs to protect themselves, we should think about masks. Everybody hears about masks, the N95 respirators, eye shields or goggles, isolation gowns, and naturally gloves. Okay, so let's just walk through those. So gloves, we're well supplied. Regular surgical mask, well supplied. N95 respirators, well supplied. And then eye shields, we have been well supplied, but they are not as plentiful. And then gowns, if we've had a worry, it's been about isolation gowns. So part of our contingency plan from the very beginning on isolation gowns was to not be dependent on the manufacturing of disposable gowns. There are the reusable gowns, and so we talked about this last week, and since last week we have implemented some reusable gowns because we want to keep our inventory for that time when we surge. If we surge, we want to make sure that we have ample inventory of disposables and reusables. So we've started putting some reusables in place. We have a supplier that will supply them, pick them up, launder them, and bring them back. So that's a portion of our supply. And then we went as far as to purchase inventory of our own gowns that are coming, and we've had the local college, Wiregrass Technical College, Dr. Tina Anderson, she has provided us some gowns her dental students and that dental program would use, and we're putting those in inventory, but we're not stopping there. We're also buying material to manufacture our own gowns. And then we have some local businesses that are exploring ways to build disposable gowns. The point I would make to the viewing public is our contingency planning is about having a backup plan for our plans. And any type of emergency situation, we want to have something to fall back on. Back to the local and state leaders, they're doing a great job pushing supplies out. We've asked and we've received. We continue to ask and we receive. So I believe that'll continue to happen, but here's the deal. If we surge, like has happened in other parts of the states, and we become overwhelmed, will that supply chain hold up? And that's what we're trying to plan for. So I would say today, we're okay on supplies. Tomorrow, I won't be able to answer that till it comes. But I hope and pray that we planned well enough to keep that supply chain coming.
Mr. Dean, you mentioned transfers in earlier in your response. Are you anticipating a large influx of patients coming in or that trend to continue?
I don't anticipate a large influx, but again, we don't know. You see, Erika, what's happening in Doherty has an impact on the region. And I think everybody can relate to this. If all hospitals fill up and we are the only ones that have capability, would we not want to help? I think we want to help. to a point, we can help. We would never want to try to help so much that we overwhelm our capability. So being helpful and accepting is what we're proud of right now. I'm not aware of a large amount of patients that is planning to be transferred here. I am aware that there is a significant number of patients that are being transferred from Phoebe and Dougherty County to other hospitals in the region, and many more than we've accepted. So the answer is, if we're hearing lots of patients are coming this way, that's just not true. If you're hearing that we would help where we can, that is true. Mm-hmm. And I would hope that if we were in their situation, they would do the same for us. And I believe that's what the community would expect.
Mr. Dean, a major topic right now in the news are ventilators, mechanical ventilators, mm-hmm. their availability in hospital mm-hmm. systems. And I do understand that you are a former respiratory therapist.
I am.
So can you tell me a little bit about that?
Well, I'm a respiratory therapist by training, and I'm not sure I can tell you a lot because technology has changed over the years. But what I can tell you is we have a fleet of adult, neonatal, pediatric ventilators. We are using some, but we have a good number for these contingency plans. But Erika, I know that's on everyone's mind, and if you'd like to, we could walk up to one of our critical care units and let's take a look at one.
Okay.
Hey, Erika, thanks for setting this up in one of our available critical care rooms. Yeah, I've got a couple of folks here I'd like to introduce to the viewing public. This is Sandy. She's one of our registered nurses, charge nurse in the critical care unit. Mickey Watley, our director of respiratory therapy, and Tammy's one of our registered respiratory therapists. Vital members of the team taking care of our community during this time. And the reason we're here is to talk about mechanical ventilators, but let me just tell you a little bit about what we have on the bed. We talked about this personal protective equipment. Of course, everybody knows about the plastic gloves. That's the personal protective equipment. We don't talk about the caps as much. This is to pull the hair back. And then, of course, some of the reusable gowns we're talking about that we can reprocess. We can see they're very good quality. And then eye shields. Eye protection would be an eye goggle or a shield we would buy from a manufacturer that would go behind the head. And we're very excited about this, so I want you to observe the quality of this. But our maintenance crowd is beginning to manufacture a replacement product in the event we're unable to buy our own. Isn't that great? And so they've done this on their own, and their goal is to have 1,000 of these produced in-house in the event we cannot be supplied by a vendor for these. So it's really good quality. And then, of course, everyone's heard about the N95s mask, and this is one that's available here. So personal protective equipment's important for what we're doing. But again, we came up here to talk about the mechanical ventilator. And as Erika said, I'm a respiratory therapist from way back, but I know a little bit about them, and here's what I know. The mechanical ventilators are about moving air in and out of the lungs when someone can't do it effectively and efficiently. So with valves and solenoids and other mechanisms that go into these pieces of equipment that Tammy's standing by, we're able to move a volume of air into a patient's lung, but we're able to do even more than that. Some of these patients require what's called positive end expiratory pressure. PEEP would be the acronym, and these ventilators allow for a little bit of pressure to remain in the lungs, and what that helps the patient do is to oxygenate even better. So very important part of the technology. See the monitor over here that the respiratory therapists monitor, called tidal volumes, and that's the amount of air that's going in, how much is coming out, and then the pressures and the rate a patient will need to breathe a certain number of times per minute. So it monitors all of that, and this equipment is important, but what's more important are the people that are capable and qualified to run it, and we thank them for that.
Thank you to everyone for tuning in today. We do encourage you to follow all of our social media channels to stay up to date, and always refer to our website for the most latest information. As well as if you have any topics of interest, please feel free to comment them below or share them with us, and hopefully we can address those in future communications. Thank you again.